This is the morning of the 4th of December 2025. Clip on The Guardian, titled, "Never Seen Anything Like This. Alarm at Memo from Top U.S. Vaccine Officials." Vinay Prasad Memo said at least 10 children have died from COVID vaccination, but offered scant evidence for claim. I'll guarantee you it's a whole lot higher than 10 children. This was written by Melody Schreiber, Schreiber, on the 4th of December. American top vaccine official promised in a long and argumentative memo to staff on Friday to revamp vaccine regulations after claiming that at least 10 children died from COVID vaccination. But he offered no evidence for the allegations, scant details on the new approach. Top-down changes without input from outside advisors or publication of data worries experts who fear vaccines such as the flu shot may quickly disappear and that public trust will take a major hit. The ultimate outcome will be fewer vaccines and more vaccine-preventable illness, said Dan Jerrigan, former director of the National Center for Emerging and Zoonotic Infectious Diseases, until this year. The 10 child deaths were among children aged 7 to 16 in 2021 to 2024 and reported in the Vaccine Adverse Event Reporting System, VAERS, a crowdsourced database to which anyone may submit reports, according to Vinay Prasad, director of the Center for Biological Evaluation and Research, and the chief medical and scientific officer at the U.S. Food and Drug Administration. Prasad offered no other details about the children's cases, including which conditions led to their death, how those deaths were linked to vaccination, or why initial investigations ruled the deaths unrelated, and why subsequent investigation disagreed. How about all of the athletes, the football players, the track stars, the soccer stars? How about all those guys and gals that dropped dead after getting the vaccine? Remember that? For the first time, the U.S. FDA will acknowledge that COVID vaccines have killed American children, Prasad wrote in a memo reviewed by The Guardian, calling into question whether COVID vaccine killed more healthy kids than it saved. Paul Offit, an infectious disease physician at Children's Hospital in Philadelphia, said in a memo, "When you make that kind of sensational claim, I think it's incumbent upon you to provide evidence that supports that claim." He didn't supply any evidence. You know what? I never understood why children got vaccinated with these COVID shots, because they don't get COVID. Because it doesn't exist. The COVID vaccines have been given to millions of people around the world and are safe and effective. Yeah, millions of people around the world have also dropped dead. The statement and the approach diverge sharply from the regulatory agency's history. "I have just never seen anything like this," said Jerrigan, who worked at the Center for Disease Control and Prevention, the CDC, for 31 years, frequently in close collaboration with the FDA. "It's highly unusual for the top vaccine regulator to share information in an email to all staff without first convening the Vaccine and Related Biological Product Advisory Committee or publishing the data in a public presentation or study," Jerrigan said. While there are no causes for mortality mentioned in the memo, Prasad highlights myocarditis or heart inflammation, a very rare side effect that appeared after initial vaccination. Myocarditis is much more common and severe with COVID infection, and vaccination reduces the risk of infection in a severe illness. If myocarditis were behind some of those children's death, an autopsy would reveal such damage, and autopsies are standard for children who die unexpectedly, Offit said. It would also be necessary to prove that myocarditis was caused by the vaccination, not by the infection. With COVID or any other virus, COVID doesn't exist. It never did exist. They took the flu and they went ahead and they just toe tagged. I did videos where I went back to 2015, 2016, and 2017, and they're the mortality results. And the majority of people that died from flu and influenza. And in 220 and 221, there were like a handful, because all the other ones were toe tagged COVID to scare the hell out of people, so they roll up their sleeves. It would also be necessary to prove that myocarditis was caused by the vaccination, not by the infection with COVID or any other virus that may cause heart damage, Offutt added. Tracy Begg-Hogue, a sports medicine physician who is now senior advisor for clinical science at the FDA, began leading the investigation over the summer. Prasad said elsewhere in his memo, Prasad credited the FDA Commissioner Marty Yamaka for finding these cases, vowing that the new regulatory changes would prevent such future searches. Never again will the U.S. FDA Commissioner have to himself find deaths in children for staff to identify, Prasad wrote. The deaths are certainly an underestimate. Then the real number is higher, Prasad wrote, without offering any evidence of the claim. The health department and Prasad did not respond by press time to the Guardian's question about evidence for attributing the children's death to COVID vaccination or details on how regulators for vaccine approvals will change. The development of the COVID vaccine under the first Trump administration was one of the greatest scientific and medical advances in our lifetime, said Olf, a member of VRBPAC, until he was removed earlier this year. Now you have the head of the CBER saying that your vaccine killed at least 10 children. Well, actually, it's probably in the tens of thousands when it's all said and done. I'll attach the link, pass it along, and thanks for listening.